Good night, everybody. My name is Joan Sebastian Barrera. I'm a med school student, and I'm going to ask you some questions. Aren't you tired of waiting in the emergency room? Aren't you tired of not being able to get sick in this country? Aren't you tired of unkind health staff? Aren't you tired of the bureaucracy of the health system? Or finally, aren't you tired of the current health system in this country? Well, Mr. and Miss Patient, I just want to tell you, it's your fault, and also it's my fault. It is all our fault, both for measuring the current system and for not demanding a better system for patients and workers. Only we can support the system to be better every day, fulfilling the laws, the few duties that patients have, are kindly demanding the rights we have. Because the system is us, and with simple changes in how we act in the system, we can improve it. I will start to tell you our principal mistakes relative to the health system. One mistake is consider that you and I are enemies. In the day by day, the patients critique workers of the health, like if the problems in the patient was their direct fault. But they don't think about the change of corruption that starts in the top of the system, more specifically in the government. The people who decide how much money goes to the system, how much staff will require the system, and other important administrative aspects. Excuse me. And what's the problem? The staff in the health system, in response to the abusive treat of our patients and critics of them, starts to forget that our practice is the patient, and we start to see the patient like a bad client and nothing more. Without consider sometimes the situation behind the concern of the patient. The first and great step to create a better health system, is to start to understand that patients and workers in the system are not enemies, and work together versus the real enemy, the inept and corrupt politics that manage the system. The second big mistake that you commit like patient is to forget that you have rights but also you have duties. The people in the present think that the person who has to take care of their health is the doctor, but no. The real person that is in charge of our health are each one of us. It's for that reason that you have to empower yourself of your health. The people do not follow the recommendations of the professional of health. They do not change their way of living to achieve a better health, and sometimes the patients don't consume their drugs like the doctor recommends. And when the consequences arrive, they reclaims to the doctors and the system for their state of health. The doctors aren't dads and the patients are kids. The relationship between doctors and patients is no longer the paternalistic relationship. It's a relationship between two adults. Excuse me. How I was saying, it's a relationship between two adults. One giving recommendations and the other taking decisions about if he wants to follow the recommendations and the consequence of following or not following those. It is for the foregoing that the next step for a better system is that you, the patient, take responsibility for your own health and understand that the first person with duties in the system is you. However, we the workers of the health system are not free of things. The new system of health is a system that puts all the confidence in the professional of health. Something that is logic, but also is a great responsibility, because in the role of doctors we can order many exams and prescribe many drugs without restrictions of price. This is good for professionals and patients, because this allows a good exercise of the medicine, but is bad for a system whose financial balance tend to negative numbers. And more if some professionals send exams and drugs without considering the costs and the real benefits of one interventions. Today exists doctors and patients that see in the system a free provider of caprices. And we can see how there are doctors and patients that want the system to provide therapies in the exterior and elevators in their houses. This is a practice that bled out the system and produced that the other patients with more important needs cannot access to really necessary services. Excuse me. It's important if we want a better health system, understand that the cost of all the therapies, drugs and services are covered by all of us, and take conscience that the systems cannot afford all the things, and it's a lack of responsibility for part of the professional and patients try to make the systems cover an absurd cost. Sometimes we think that the solution of our problems go beyond us, but if we think about it and take conscience about our role in the society and the problem of our society, we will start to discover that the way we act before a situation is part of the solution. It's for the interior that I talked to you about the situation in the health system, because only if we know about it and if we take conscience of our role in the best for a best system, only in that way we will find out that we can do a great change in the system. Good change that will benefit the patients and the staff of the health. Don't forget, never that you and me, patient and worker, we are the system. And if we want big change, the change must start in us and the ways we act in front of the system. Thank you.